Hi there. Welcome to the third webinar in the Better Practice series, Introduction to Benchmarking. I'd like to acknowledge the Gadigal people of the Eora Nation as the traditional custodians on the land on which the NIDA office is situated. We extend this acknowledgement to all Aboriginal and Torres Strait Islander people across Australia and pay our respects to elders past, present, and emerging. Now, I'll be your host today. My name is Rosemary Miller. I am the Research and Data Management Officer here at NIDA. My main projects I work on are NIDAbase, which is a database we provide for use by members to enter their minimum data set data. And I'll also be joined today by Susie Hudson, who is NIDA's Clinical Director. So just a quick overview of what we'll be covering today. So to start off with, to set the scene, I'll be going over an analogy to think of benchmarking, just to make it a bit easier for you to kind of wrap your heads around it. And then we'll be doing a recording with Susie, who is unfortunately on a plane at the moment, but she has kindly pre-recorded a section of this webinar for you. So she'll be here in spirit. She'll be covering what is benchmarking, the key concepts and definitions, benefits, approaches, and how-to for benchmarking. And then we'll return back to me where I'll finish off the analogy for benchmarking and I'll do a wrap up of the Better Practice series. Okay, so I have an important question for you and just think about this. If you want, you can pop your answer in the comment section. How many of you have pets? Now, there's a lot of decisions that go into having a pet because, well, for one, they're adorable. So why would you not have a pet? But two, pets are a lot of responsibility. And if you think about it, all the information you're going to access for why you would or wouldn't get a pet is a bit like benchmarking. You're going to maybe ask people for opinions. You might, interview vets to see which is the best pet or animal to have as a pet, even like researching what kind of pet you even want. Now, those of you who happen to have turtles as pets are in luck today, because now I would want you to think about, as we go through the webinar today, what factors would impact your decision to choose a pet turtle. And I know for me, turtles, how cute they are going to determine if I choose a turtle as a pet. So if you think about it, this little guy, he's brightly colored and kind of cute and small. But what if you want something a little bit darker? See this little guy, he looks a little bit more, adventurous. What about this little guy? Like he's slightly bigger. What if you prefer that kind of look in a turtle? Or this little guy, his shell is really cute. Or maybe none of these, maybe you're actually just a cat person or a dog person, not to leave the other dog people in the lurch. Now, this example may seem silly, but this is an example of the kind of data or information you need when you're doing benchmarking. So if you think about it, all around us, we're constantly making decisions. Even when you go to the supermarket, how do you know which brand of cereal to get or what kind of bread? Like these are all examples of benchmarking. And so what we'll be going through today is how you can apply that practice to your own organization. So our dilemma is which turtle is the cutest. So I want you to think about this as Susie presents the information in this webinar. And also I've set up a Menti survey. This is just an online survey you can go on to online and you can actually vote for which turtle or the kitten you want as your favorite, cutest option. And after Susie's recording, we will have a look at the results of the survey. And this will be an example of how we can use data to benchmark which turtle is the cutest. Cool. And so just as we go on to Susie's section, I just want to re-emphasize that in order to benchmark, we actually need data. And when I talk about data, I don't mean just numbers, I mean bits of information. So this could be, you could collect this kind of information in several ways. And so when we're talking about benchmarking in your organization or your service, we're talking about maybe the bits of data that you're already collecting as part of your practice. And yes, again, it may seem silly to think about the pet analogy, but again, this is a really good way to kind of, as a first step towards thinking about how benchmarking can improve the practice in your organization. Also, I've been very specific about choosing the turtle as a pet, because if you think about more popular pets like cats and dogs, they don't really capture the idea that benchmarking is a slow and steady process. And I think the analogy of the turtle is really good for this, because you're thinking about something that is going to have long-term benefits. And while turtles may not be fast, they are cute and they do get around in their lives. And, you know, the tortoise and the hare, the tortoise does win eventually. Okay. So without further ado, I will begin Susie's part of the webinar.
Yeah, I'm Susie Hudson. I'm the Clinical Director here at NADA and really happy to be joining you today to talk a little bit about benchmarking. So I'm going to take you through some of the basics, introduce a couple of concepts to you and come along on this journey with me. So what is benchmarking? So essentially, benchmarking is really trying hard to come up with a standard point of reference. It's looking at a process of comparing different aspects of an organisation with internal and sometimes external benchmarks. My beautiful turtle friends will be joining us today. And as you can see already, we're starting to see there are differences. There are ways of comparing and contrasting. It really helps, particularly around governance practices, to encourage an organisation to reflect on the things they do and to identify where there might be improvements that can be made. So let's have a little look at what the purpose of benchmarking is. Essentially, it's about understanding what is standard, good or best practice, seeing how your organisation might compare to those standards, and identifying what can be done to improve or to meet that benchmark. Some people can get a little concerned about what that means for them in practice, but ultimately it's really about engaging with your staff, your clients and consumers to really think about the practices you do now, how they compare to other practices, and the ways in which you might improve. It's not about trying to allocate blame or attribute issues to a particular way of doing things or a particular group. It's simply about being open to a process of reflection, which is actually something that we ask of our clients every day. How are they going? How are they going from before they came to see us? How might they like to be in the future? So it's a really nice way of bringing a lot of those practices that we ask of our clients into our organisations. So why benchmark? You know, it can often be a bit of a red flag to people. People can feel a bit like, oh, what might this mean? What might it mean to us? You know, are there particular red flags that are going to be raised? There might be a bit of a public service announcement to an issue. But really, it's trying hard to ensure that we're accountable, that we're providing quality services, and that we can know if we're doing the best that we can possibly do. And that's why we would encourage you and the people working in your organisation to think about benchmarking and the way that it can inform the practice that you provide. So what are some of the benefits of benchmarking? So one of the key things that can occur in a benchmarking process is that we can be alerted to new ways of doing things. We can start to think about being more innovative. We may have been perhaps doing a particular practice for a very long time in an organisation and not necessarily questioning what we could do differently, what we can do better. Sometimes, and you may have had this experience, we might have a student come and do a placement at our service. And it's usually those naive questions about why do we do this particular thing in this way that might prompt us to query exactly that. Why do we do these things in a particular way? So the beauty of benchmarking is that it provides a measure of accountability. It's really looking at being as transparent as possible to clients and stakeholders, that we know that a part of the work we do should be evaluated, reflected on, thought about, and that we can start to establish what might be the standards that we should be reaching for or trying to go beyond. It really also helps in terms of facilitating or streamlining the quality of data collection. So it gives us meaning and purpose. Why do we collect the things that we do? Anything that we're collecting, whether it's information from our clients or consumers, whether it's information about a process we might be involved in, we should be doing it for a purpose. And that's where benchmarking comes in. It helps us to say, this data collected at this time will give us some information about how we're doing. Just as I said before, we ask of our clients. It also contributes to establishing that best practice. So the more information we get as an organisation or as a sector, we can start to establish that benchmark, that this is the standard that we're all going to strive for. And why is that? It's mainly because we want to say to the community and the people we serve that all of the services that are, say, member services of NADA, all the people that provide drug and alcohol treatment are striving for this standard. So no matter where you go to get your treatment, you'll all be getting good, high quality care. So it doesn't matter whether you're in a rural area, in a metro area, the benchmarks help indicate to the community, consumers, and to our organisations that we're striving for the best possible care for everybody. Some of the other benefits are really about understanding what are the strengths or weaknesses of your particular organisation. What are the things that could really be strengthened? You know, what are the things that we do particularly well that we'd like to demonstrate? What perhaps can other organisations know about what we're doing? And also, indeed, to identify what might need to be improved. It can also help us to explore potential performance by looking at other organisations or other examples and really start to think about where we might do things differently. And ultimately helps us have that continuous review of development. And that can only benefit the people that are working in the organisation, most importantly, the people reaching out for some support. So we would absolutely encourage you to consider benchmarking, to think about what that process involves and who would get to have a look at it and who and where we would find the information to start the benchmarking process. So before I go any further, I just thought it might be useful to explore with you a couple of definitions that we'll be using as we go through this process. And one of those that you'll be very familiar with is a performance indicator. So what that tells us very clearly is it's a measure of what is being done or achieved. So we can be really clear about the things that we're trying to achieve through the process, and in this case, of treatment and care. Now, key performance indicators are the benchmarks that actually have been chosen to measure how successfully a service provider has done in achieving these objectives. And so you would be very familiar with the KPIs that are asked of you. And more recently, we've seen through the Ministry of Health, in terms of the state funding reporting, that there's been an effort to try and consolidate some of those. And really, once again, key performance indicators are trying to establish these benchmarks of what every person coming through a service should receive so that it's consistent and we can be confident that the quality of the care is high. So let's have a little look at different types of benchmarking. Really, essentially, there are two main types. One is a process or process benchmarking, and one looks specifically at performance or performance benchmarking. Now, process benchmarking is really analysing or exploring processes rather than activity levels. So you might think of something like a process around your waiting list management, or you might think about a process where you're reviewing your policies, for example. And so as part of process benchmarking, we're looking at the components of effective practice. We're looking at why is a specific practice effective? So why do it in this way rather than an alternative way? And what factors might contribute to the practice's effectiveness? So really breaking it down into the different parts of the process. In performance benchmarking, we're really looking at some of those activity levels of particular processes. So we're really looking specifically at outcomes, how effective is the process. So in terms of the data collection, it might be particularly looking at the proportion of a particular group that are coming through the service. What might we do to improve that? Maybe it could be particularly around the changes to a process. So if we put in a different type of intervention, what occurs in terms of that performance? So what's important with performance benchmarking is actually setting those particular targets. And they might be based on previous data that you've collected. So it might be something over time that's happened, or it might be something that's been provided to you from a funding body, for example. And so they're the two key types of processes. If we step back, we can then start to have a look at the whole process as a whole. And this diagram comes specifically from the benchmarking guide. And it really helps very specifically to help you see that it's a process, that everything is happening in that feedback loop type of process, that as each type of stage of a benchmarking process is happening, we're reflecting on it. We're thinking about how it feeds into changing of processes. We're looking at reviewing things at all times. And then I suppose thinking very clearly about, having done these particular types of actions, how they've been implemented. How has that process gone? We know that in terms of trying to benchmark a process, we're really clear about implementation being one of those key parts of the process. And so we need that constant approach of reviewing to ensure that we're doing all that we can to look at how the process is going. And so how do we actually benchmark? One of the key things is really thinking around deciding what it is you want to do in terms of what area of focus you're going to have. It shouldn't be a standalone activity. It shouldn't be a separate thing. It happens as part of a quality improvement process. And so looking at your quality improvement plans can often be a great source for identifying where to begin. So it's looking at some specific one-off comparison activities perhaps, or looking to perhaps improve a particular process that you already have in place. Another particular thing that's important is really thinking about how we're going to demonstrate, how we're going to communicate what we're finding in terms of the benchmarking process. And so that happens via reporting and storytelling. So you're demonstrating compliance and good practice, looking at the improvements and transparency, and you're learning all the time. But that you're quite clear about how that learning is going to happen, and that's being documented along the way. The other thing to think about is that by having these processes in place and well documented, you're really demonstrating leadership, both within your organisation, but also to the sector as a whole. And so it's really important to start to think about all of these different elements of benchmarking in order to ensure that you're doing it in a well-planned, well-delivered way. When we look specifically around client program and treatment evaluations, we mentioned those a little bit earlier, it's really about looking at the measurement of performance over time. And you're looking at external standards, perhaps from other organisations, or maybe it's from a piece of research. It's actually started to tell you something about a particular way of doing something. You're looking at identifying trends. So what might influence, what might be areas for improvement, but particularly too, perhaps around an example might be thinking about who's coming through the door to your service. So should they're looking at the broader data, so for example, the national minimum data set, on the whole, who's coming through the doors to attend treatment? How does our service look in terms of that mix of people coming through the door? Are there gaps? Could we be looking at ways of improving engagement with particular groups of people that we might not frequently see? And is that appropriate? So really thinking through different types of places you could find information that might give you a signal about the benchmark against which you might want to be looking and comparing your own work. So in terms of that idea of where and how, We're really looking at some different steps, and it's really helpful at the very beginning to really take this overview so that you know that you're adhering to each step along the process. And so identifying what you're going to do in terms of the benchmarking activity, you really want to be realistic about what you're going to look at, how you're going to support your organisation to engage in this activity, and really getting the staffing group on board so they can see the value of why you're doing these things. And then to really think about the type, the area of activity, or whether it's going to be internal benchmarking, as we said before, or external with an external organisation or an external piece of data or information. You might want to consider too your collaboration partners or partners that you might go with. And in that, due diligence is really important. So thinking about organisations that you feel comfortable with, that might have some like situations to your own, looking at the costs and benefits or the risks and benefits to that collaboration, and really trying to balance out how similar or different they are to your organisation. But it can be a really helpful process and a nice way to develop your approach. And then looking to measures and the indicators. So what are the things, the processes and performance indicators you're going to specifically target and have to compare yourself to? You might be looking at different types of benchmarking around, is it around effort? Is it around the quality of the treatment or the intervention that you're doing or the process that you're implementing? Or is it about the effect? And they're all very different. So it's worth having a look at some of the guides and being really clear about which you're falling into. And then, of course, your data. So trying really hard to look at what is the existing data you're already collecting so that you're not putting another undue burden on what's already happening. And then really thinking about your data collection methods. Can you be using routine data collection and feeding that into the process? So really trying to see what you've already got before you go on to add more data collection. There are challenges, obviously. It's important to raise, but it's usually around not bringing perhaps your organisational group on the journey. So that's really key. And that's that idea of making sure that there's, if there's low or little commitment, it's really about explaining what the purpose is, why we're doing this and why it could really be important in terms of the work. Things around, finding suitable partners, that can obviously be a challenge, but looking beyond your direct neighbour, so looking out and seeing, there might be but not exactly the same organisations that are doing particularly well, say, with how they manage their data collection. So you can learn from different sectors. That's absolutely possible. So it's really thinking broadly about who those partners might be. Of course, there are always resource constraints. So start small. So really thinking about containing a project and really, once again, making sure that the quality of the data that you've got is up to scratch. It's going to actually give you what you need. So really doing a good audit of how you collect data at what time can be hugely helpful, and actually a benchmarking process or project in and of itself. How well do we do in terms of collecting our follow-up data, for example, in terms of, say, outcomes? And so thinking again about what these challenges are, that you explore that at the beginning part of a benchmarking project. So you can already start to see what strategies you might put in place to mitigate some of these challenges. The key thing, however, is to really think about how you're going to bring people along on this journey with you, making sure that they're confident about why and how, when they're going to do what they're going to do. And so in summary, benchmarking, as we've explored, is absolutely a continual process. And you'll remember that diagram that I showed you. It's that feedback loop. In whatever you're starting with, you're reviewing every step of the way and then making adjustments in response. Absolutely. I hope you've enjoyed our little turtle friends. They certainly tell us that it's all about slow and steady. It's not a fast-moving process. It's really taking your time so that everybody's on the journey with you, starting small, starting to integrate it into all aspects of your own practice, thinking as that reference point always of our clients, they too are doing continual benchmarking in their process of treatment. To think around building that culture of organisation being invested in benchmarking and seeing it as a real positive to improve the work they do. That it is a bit of a slow and steady, but slow and steady absolutely will win the race. So I hope that's been useful in terms of an overview of benchmarking. I'm going to hand back over now to Rose Miller, and she'll take you through the rest of this series. Thank you.
Hi, everyone. I hope you enjoyed that. Thank you, Susie. That was really informative, and I am hoping you can see how your turtle friends have really helped you on this journey of benchmarking. And at this point too, you may be thinking back to some of the previous webinars about evaluation and performance management, and seeing how the content of those two webinars have tied in with this final one about benchmarking. So let's return back to our dilemma. Which turtle is indeed the cutest? Oh, there you go. We'll return to our dilemma of which turtle is the cutest and which we would want to pick as a pet. So when we're thinking about this, now you've had some time to reflect on what benchmarking is, and thinking about the turtle analogy that it's a slow and steady process, as Susie mentioned. How do we objectively know which turtle is the cutest? And so what I'm hoping is that by now you'll see how data and information is going to help us to make that decision. Now, in this case, we're only going to use a small sample of people who may be attending the webinar today. It'll be your votes who will be able to use to benchmark which turtle could be the cutest. But that's not to say that this same process wouldn't help in your own organization. And this is really a small scale version of how we could collect data to benchmark in our own organizations. As Susie helpfully mentioned, you could already be collecting data within the practice of your organization every day, interacting with clients, that you could use to benchmark. Oh, look at that. Like, oh, there you go. We've got a couple of people who have voted, and it looks like the middle turtle and the cat, the kitten, has won. Okay. So obviously we'd need a bit more data to be able to definitively say which is the cutest of this group. But yeah, so this is an example of how you could use data for benchmarking. Okay, so I'm just going to do a little bit of a wrap up of the Better Practice webinar series. So if you've been on this journey with us over the last 3 weeks, so we've done enhancing performance management, introduction to evaluation, and introduction to benchmarking. And really the overarching ideas are that you're able to use data to inform and improve your work, and also use these practices in order for to improve quality at your workplace. And so there's lots of ways that you can do this. And what I'm going to do now is open the floor to some questions. Oh no, wait, sorry, before that, what I'll do is talk about some of the future directions. So basically what we're thinking is that later in the year, in the new financial year, we'll actually be running the 3-part Better Practice series as a group of face-to-face workshops. So if you'd like to explore a bit more about performance management, evaluation, and benchmarking, feel free to sign up for those webinars later in the year. And now we'll take some questions. So I'll see if I've had any. Okay, so I've had some questions. So question 1 is, benchmarking all sounds good, but how do I convince my colleagues to put benchmarking into practice at my workplace? That's a really good question, Anonymous. So I've actually had this challenge before. If you were at last week's webinar, I did present part of that, and I talked about my experiences as conducting part of a program evaluation. So I actually have been in this position where I've been the one collecting data that's going to be used for benchmarking in the future. And so really, the idea is that while you can't change people's minds, what you can do is lead by example. So I would emphasize that if you are going to start a benchmarking project, whether you're a manager or you want to do it to improve your own performance in your own workflow, I would start small. So something like, say, as a personal example, what I do is each day when I come to work, I'll actually record like how much I'll do of each task. And that helps me to keep track of like how much I'm accomplishing in each day. And it also helps me to see, particularly times when I'm feeling overwhelmed, whether looking at my task list and seeing, is it more or less than what I would normally do? And I find that to be a helpful process. So really, convincing your colleagues, it's more about leading by example, and thinking about how you can introduce benchmarks into your own practices. Okay, so I've got another question here. I don't know where to start with benchmarking. Do you have any suggestions? Oh, well, I've just covered some. So in your organization, depending on what your role is, say for instance, if you are, say, you assess people who are coming into, say, a treatment service, one thing that could be very useful is starting off with something simple as maybe your wait list, or how many people you do assessments with in a particular day. It's really going to depend on the unique needs of your organization. But what you'll find is that if you kind of take a step back and look at your daily workflow, you're going to see lots of examples of things you could do to benchmark. So in the case of, say, wait lists, what you could do is it could be something as simple as when someone contacts you to be put on a wait list to enter your service, you collect the date that they did that. And what you can do is you say something as simple as an Excel spreadsheet to calculate how many days they've been waiting. I've used actually a very similar process when I was collecting data for a program evaluation. So I needed to track when a client entered a service. So, and between then and when I was able to approach them to recruit them into the evaluation. So that's using informed ethical procedures and checking with them to see if they'd like to be a participant. And so what I would do is track the amount of days that would pass between when the person was took into the program compared to when they were approached to be recruited. So something as simple as that can be a really good suggestion to start with benchmarking, and you can also adjust it to suit your what your particular position is. Let's see, is there another question? Oh, this other attendee has asked, we have performance benchmarks at my work, but I don't agree with them. How do I talk to this about this with my manager? That's that's an unfortunate situation. Yes, sometimes benchmarks, when you enter a new workplace, believe it or not, like a lot of times there will be things, standards or expectations or KPIs that exist that you may not necessarily agree with. And sometimes there's good reasons for that, but other times it could be that maybe a type of benchmarking was done in the past, and they've just the organization has kind of kept those benchmarks around and haven't really thought about how to adjust them to fit with what you're currently doing. So I just want to emphasize here that benchmarks, they're not supposed to be like black or white. They're something that's used to kind of guide performance or monitor your processes. They're not meant to be absolute. And you see this a lot in research. So the whole idea of conducting research is that you look back at existing research to be able to kind of get an idea of where your results could be heading. And you can do that. It's how it works in an organization as well. So the current benchmarks or KPIs or performance indicators you have is a way to monitor your performance or the performance at your work or the processes, and compare that to previous. So if you don't agree with something, I would just suggest that you raise it with your manager, but do it in a way where you've kind of looked at your data that you currently have to see where that should change or should not change. So whether the current benchmarks are too high or too low, if you've got some sort of like data to back that up, whether it's like really simple or like if you do want to do graphs or something like that, feel free to. You could actually, if your service does have access to database, so there's two types of database users. So you could enter data directly into it, or you could access you use your own data system and it gets uploaded to database. If you are able to access database, there's actually reports and other things that you could use as evidence to argue for or against a benchmark if it comes to client data. So hopefully that helps. And yeah, good luck, Anonymous. If you do have any other questions, feel free to email us. Yep, so I've got here the Better Practice contact. So yeah, just email any of us. So that's Tata De Jesus. Susie Hudson, Sienna Hodge, and Rose Miller. So yeah, just feel free to call us or email us, and we're always available here for you. I'll also spruik, there's a project I'm working on at the moment called the Research Capacity Project. So it's a research study that's a collaboration between government and non-government services, drug and alcohol. So basically what we're trying to do is assess the capacity of staff in services to conduct research. So it is live now. So if you like, you can click the link in these slides when they're sent out to you to complete the survey. And also with the follow-up email, we'll send out a blurb so you can participate if you'd like to. And also the latest advocate is out now. So be sure to check the NADA website. And yeah, thank you so much for coming along on this journey with us in the Better Practice series. And we appreciate your attendance today. So thank you.